Getting outside and moving around is a great way to stay healthy. However, injuries from outdoor recreational activities often land victims to the emergency department. One of the most common injuries sustained is fracture.
A fracture is a broken bone. A bone can break when significant pressure is exerted on it. There are two types of fracture. First, closed fracture, when the broken bone does not break through the skin. Second, open fracture, when the skin is torn and/or penetrated by the broken bone. Both closed and open fracture causes bleeding. Broken bone may cause internal bleeding severe enough to develop hemorrhagic shock. To assess whether the victim has a broken bone, look for these signs: pain, swelling, and bruising, unusual angulation, shortening, twisting, or a bend, inability to move the affected area, and bleeding in case of an open fracture. Remember, when a large bone is broken, such as the pelvic or femur, victim may have signs of shock, such as paleness, nausea, and dizziness. There are few things you can do to help a victim with fracture at the scene. Firstly, if this is an open wound, cover the wound with a clean cloth or a sterile dressing. Apply pressure around the wound and not over the protruding bone. Secure the dressing with a bandage. These are to prevent further bleeding from the open wound.
Then, support the affected limb to stop it from moving. Make sure to hold the joint above and below the injured area. You can place an extra padding around the area for comfort. Bandage the injured area to support the affected limb. Be careful not to bandage the limb too tightly. Lastly, immobilize the limb to avoid worsening the fracture and to reduce pain. If the injury is in the upper limb, you can immobilize using an arm sling. To put an arm sling, you need a triangular bandage or any piece of cloth resembling the bandage. The triangular bandage has two ends over the longer side and one end over the shorter side. With the victim supporting the injured limb, place one end of the longer side on the shoulder of the uninjured side. Ensure that the end of the shorter side is at the elbow. Now bring the other end over to the shoulder of the opposite side and tie the end together. Make sure to keep the limb slightly raised. Twist the end and tuck it inside to keep it neat. If the injury is in the lower limb, you can immobilize the injured leg using long stick, rod, or newspaper at each side of the injured leg and bandage the limb together with the stick. Or you may place a support using towel or cloth in between two legs and tie the injured leg to the uninjured leg together.
Victims with fracture require further evaluation and treatment. Do not forget to call 999 and wait with the victim until help arrives. Remember to watch out for signs of shock.